A 15-year-old boy is brought to the physician because of a 3-day history of right foot drop. Physical exam shows weakness of the right ankle dorsiflexor muscles. The right ankle eroder muscles have full power. Sensation to pinprick is decreased between the great and second toes of the right foot. Sensation over the rest of the foot is normal. Which of the following nerves is most likely damaged in this patient? The most common nerve that results in a right foot drop is the common fibular nerve. The common fibular nerve is going to be responsible for dorsiflexion as well as eversion. But this question tells us there's weakness in dorsiflexion, but there's no weakness in eversion. So eversion is fully intact. As a result, it can't be the common fibular nerve because if it were, then we would expect a weakness in dorsiflexion as well as eversion. Now, the common fibular nerve is going to divide into the superficial fibular nerve and the deep fibular nerve. Now, the motor function that the superficial fibular nerve is going to be responsible for is going to be eversion. And the mnemonic that I use to help me remember this is by remembering the word pervert. So the PER in superficial can be combined with the VER in eversion to make up the word pervert. Um, it's a quick way to remember this. So if this helps you, then you can also use it. Now, the deep fibular nerve by default is then going to be responsible for dorsiflexion. Okay, so the common fibular nerve is going to have two motor functions, dorsiflexion and eversion, and then it is going to divide into superficial fibular nerve and the deep fibular nerve. Superficial is going to be responsible for eversion, and the deep is going to be mainly responsible for dorsiflexion. Now, the sensation of these two nerves are going to be that deep fibular nerve is going to be responsible for sensation between the great toe and the second toe. So it's over here. Whereas the superficial fibular nerve is going to be responsible for the lateral leg as well as the dorsum of the foot. Okay. So if you take a look at the question again, the patient is having weakness in the dorsiflexor muscles as well as a decrease in sensation between the great and the second toes. So this is going to be consistent with the deep fibular nerve. As a result, the answer is going to be answer choice B. Now, the other mnemonics that you can use to help you remember the function of these nerves is you can use the mnemonic tip for the functions of the tibial nerve, which is going to be for inversion and plantar flexion. So this is going to be plantar flexion. And you can use the mnemonic decal for the functions, the motor functions of the common fibular nerve. Remember that Deco used to be a Brazilian soccer player, and that is how I remember the motor functions of the common fibular nerve. The D is going to be for dorsiflexion, and the E is going to be for eversion. So hopefully these mnemonics help. Thank you for watching.